Good morning, everybody. We'll go ahead and we'll get started. I want to thank everybody for joining me today. I'm Christy Stewart. I'm the Physician Relations Coordinator for the Medical Society of Delaware, and I want to thank you all for joining us for this great presentation on health literacy and the Voluntary Initiative Program. It's going to be a great session. We have two speakers today, Greg O'Neill and Michelle Seymour. Our first presenter will be Greg O'Neill. He is a Director of Patient and Family Health Education. Greg leads the strategic plan for patient education and health literacy initiatives at Christiana Care. After moving on from direct patient care as a trauma surgical ICU nurse, Greg has developed a team of nursing professional development specialists who champion health literacy best practices system-wide and support all manner of patient education initiatives and vendor relationships. Greg has been with Christiana Care for 17 years and received his MSN as a CNS from University of Delaware. Greg also sits as the chair of the Health Literacy Council of Delaware, a statewide organization focused on raising awareness, advocating for policy change, and educating and training around health literacy across the state. Before we do get started, if anybody does have any questions throughout the presentation today, there will be a moment after each presentation to ask questions. If a question does come up, feel free to enter your questions in the chat box, and we'll go ahead and read those questions off once the presentations have ended. Thank you, Greg. The floor is yours.
All righty. Thank you so much for that. I always forget about the bio part, so thanks for sharing that with everybody. I wear a few different hats, and today I'm wearing my Health Literacy Council of Delaware hat. So while I am the Director of Patient and Family Health Education at Christiana Care, I'm trying to bring that message to not only our own organization, but across the state, and that's why we formed this council. So I'll share a little bit about the council today and what we're doing. Mostly what today is about is helping share the message of what you can do to help the folks that you're trying to care for navigate health information more effectively. We have a role to play in that. You have a role to play in that as you work in the system. So I'm going to share some of those things with you today. I could speak on health literacy for hours, so I'm going to be moving very quickly today, but you'll have a PDF of these slides if you want to refer back to them. And I've only got a half an hour, so I'm gonna get rolling. Just a caveat: I do consider health literacy, or we should consider health literacy a clinical intervention. I'm an advanced practice nurse. I've worked in direct care at the bedside, and I hope that today's presentation really resonates with you because I'm not going to be sharing any, diagnostic tests or pathophysiology. So sorry for the clinical folks in the room, but this is an intervention that really has a greater impact than I think is widely appreciated. So there'll be some things here that you can take away and apply today in your practice, and hopefully some ways of thinking that will help you, change your strategy over the next few years to be more sensitive to the way that we communicate with patients and families in our communities. So let me get rolling. Why do we share this message? Because the challenge around health information and communication is very widespread. The data we have for national data for health literacy is pretty old at this point because there haven't been any more national studies. But if you really think about and talk to your patients, I think you'll see that most people in one fashion or another are struggling to navigate health systems, to fully understand health information, the mechanisms that we have set up in our health systems and the way we provide care oftentimes are very rapid paced and really don't take the necessary attention and priority to people's understanding of their health. So this is something that we say affects about 9 out of 10 people because even for me, as a nurse, I have encountered situations that I was unfamiliar with. And if the system is not set up to help you understand that situation, you're really going to struggle. So keep that in mind as we move forward today. I am going to be sharing things that direct care folks can be doing to intervene in this situation. But for you administrative folks on the line, also there are things that we can be doing with our systems and our practices to set people up for success. So here we go. Some of the statistics from Delaware specifically, we've got a real problem with general literacy in our society, honestly. What happens when you spend, 10 or 15 years having fourth grade reading levels be in the 45 percentile range for proficiency? Well, those kids grow up through the system, come out and become adults that we're caring for, who may have literacy challenges in general, and health literacy is a part of that. So one of the numbers that we have found is in some of our work is that 56% of Delawareans read at below a sixth grade reading level. You may not think of that on a day-to-day basis. As people come through your practice, it may not be readily apparent because people can be very good at shielding you from the difficulty that they're having with information, and we may not be doing a good enough job really assessing that. That's a lot of people. Those are the folks that we're caring for in Delaware, half of adults. From our landscape analysis, about 33% of Delawareans find health information difficult to understand, and roughly, two-thirds need some kind of assistance when it comes to navigating all the things that we use. We are very well-intentioned, giving lots of information to our patients and families, but a lot of folks need help navigating all of that material. So keep that in mind. In case you're wondering what the definition of health literacy is, if that's a new term for you, this has been around now for around 30 years, the concept of health literacy, and it has evolved a little bit over time. The most recent definitions that came out with Healthy People 2030 are the personal side of health literacy, which means each and every one of us has a different ability to find, understand, and use information to benefit our health decisions and actions. So that's how you personally navigate everything. The other side of this definition is the organizational side, and that's the degree to which our organizations make it easier to find, understand, and use that information. Are we using the best practices? Are we setting people up for success? That may be an opportunity for the folks in your care domain to really change the way your system approaches. So keep that in mind as well. We can be doing things at the system level, not just at the personal level. Why health literacy matters. Okay, so why is this even important? Why did MSD ask me to come and speak to you guys today? Well, it's having a bigger impact than you may realize. The folks that the different ways that this presents itself, I'm going to spend a couple slides sharing that. Folks may misunderstand their instructions. If they're calling your practice back and asking for clarification, that means that we missed an opportunity in the first place. Folks may have complications, may have inadherence to the treatment plan, things like that. Folks oftentimes feel uncomfortable asking questions. There really is kind of a deference to medical professionals. A lot of folks are kind of nervous around doctors or in a medical setting. They may not feel really empowered to ask questions. So that's something that we need to be sensitive to and try to change. And there are actual health outcomes that can be affected through just the communication aspect of this. So we don't want all of the well-intentioned efforts that we're putting into our patients and families to go to waste. One of the biggest things I hear about is, I don't really have time for this. I don't, we only have 15 minutes per visit. Well, make that 15 minutes count. There is no point in, throwing the kitchen sink at someone if they're not going to be able to retain and use that information. And I'll talk a little bit more about that later. In terms of the impact, this really can have a huge impact on our community and the folks that we're trying to care for. If you think about folks using preventative services or managing their chronic conditions, or how many people go to the ER, as their primary care, and then may end up getting admitted if the problem is too far along. And with medications, there are a million opportunities for medication regimen adherence to go sideways. Folks may not understand the implications of what the medications are that they're taking, and this can actually have an impact on mortality. So the reason to lean into health literacy as an intervention is to help with all of these things. And studies have shown that if you focus on the communication and health literacy aspect, you can have a positive impact on all of these metrics that presumably you care about. And this is a widespread thing. It doesn't just impact our patients. It's the patients and families, of course. It's also us as healthcare providers. It's community organizations who may be trying to fill the gaps and help people along the way. It's our schools and workplaces and our public health system as well. We all can do a better job working together with these best practices to try and lighten the load a little bit on the work that it takes to find health or to stick with your plan, your treatment plan, make healthy decisions, those kinds of things. So it's really up to all of us, which is why we're sharing this message statewide. So the Health Literacy Council of Delaware was formed about 3 years ago in earnest, and we have been working with a statewide strategy with a whole bunch of different partners to do these three things. I won't read all of these to you because you'll have these slides, but the idea is health literacy needs to be a part of any conversation where you're talking about interventions to help people. What aspect are we addressing around communication? Making sure that we have strong partnerships. So MSD has been with us, the whole way along, recognizing the importance of bringing this to our provider community and to our health system community, and eventually to benefit our patients. Another thing that we want to do is make sure we're hearing back from the community about what it is that they actually need. We don't want to be prescribing solutions that don't fit what the issues are. So we're very sensitive to involving community organizations and getting feedback on how to address this issue at the community level. Like I said, we have a strategic plan. You can go online and read it on our website. Won't say much more about that, but I will say that we have a few different angles that we're coming at this from. We have a primary board that sits with representation from all of the health systems in the state and public health and a few other entities, including payers. We also have some subcommittees that have formed to try and address specific aspects. So what can we do with policy to influence the way we communicate? What can we do for training up? That's what part of today is part of this training and education element of our council. And then, like I said, what can we do with community outreach to empower our community and learn from them about what they need? All right, so there are some best practices. I'm going to only talk about two of these for the most part today, but you have these now. You have this, and you can learn more about each of these. But in each of these best practice areas, you can have a huge impact on how what you're trying to do is working. If you're trying to communicate with patients and families, do these things, do these five things, and you're going to really greatly enhance the chance that it's actually going to work. So today I'm going to spend some time talking about teach back. That is the number one priority best practice. If you learn nothing else from today, please take away the teach back information and start applying it. And then I want to say a little bit about plain language as well. Also, it is really important that we don't overload people. That's the prioritizing piece. And including a support person is something that can, double your odds that someone will remember everything that you shared with them. That home caregiver person can really help. And then, of course, preferred language. If you're not sharing information in someone's preferred language, you're just missing the mark right from the gate. So what is teach back? This may sound very simple, but it is harder to do than you might think to do it well. So teach back is this communication strategy. It's really about creating a closed loop where it's the only way for you to really understand where the person's at. Are they understanding this information, or do we miss the mark? Miss the mark. So if we're doing an explanation in an appointment or some kind of a care setting or transaction, even if it's on the phone, if we're explaining something and we're not hearing, anything back from the patient other than one-word answers, we're not doing teach back. We've been doing sessions here at Christiana Care with our different physician groups, and it is remarkable to me how well-intended people are. People really want to share information. They want to make sure patients have everything they need to know, but oftentimes it's one-sided. So what I've started really sharing with folks is if it's not more like a 50-50, if the patient or the patient and family are not expressing their understanding about the same level as you are doing explaining it, to where there's sort of both sides sharing 50% of the conversation, then you're really not gaining any understanding of where they're at. So let's shoot for that more 50-50 level where you're getting information back. They should be able to explain it back in their own words. They don't have to use medical terminology, and that's the only way you're going to know if they're leaving the encounter with any kind of understanding. So here's this is again, this isn't rocket science, but you'll be surprised at how hard it is for people to change the way that they speak and go through these encounters. So you want to explain the key points. Again, don't overload. Key points using plain language. That means as simple a terminology as you can possibly use. With half of the state reading below the sixth grade reading level, if you come in with a ton of medical jargon, really trying to do your best to explain all the pathophysiology of their disease process, you might miss them right from the beginning. So you want to use plain language, explain key points, and then you have got to stop and take a moment and get them to say something back to you. They need to explain back their understanding in their own words more than just nodding their head and saying, "Yep, got it, no questions." And if they miss the mark, that's our opportunity. Teach back is an intervention and an assessment all in the same package. So if we don't hear back what we expected to hear, that's our chance to re-explain it in a different way or to bring in an additional resource like a leaflet or something, or a video or something like that, some kind of education tool, some other way of explaining it, and then doing teach back again. So this process should be circular. We should be doing this until there's a shared understanding. And we know that when that person leaves the door, the office walks out the door, they understand what's going on, right? We need to know that before they leave to avoid all of those other complications that can happen if they don't. So I'll dive in a little bit deeper than that. That four-step process is a very simple explanation of teach back. To do it really well, there's a few other layers to this technique. So if you can tolerate me for a few more minutes, I'll share with you some of the specifics, and you'll have these after the presentation. People will not trust you if they don't feel that your nonverbal communication is really connecting with them. So make eye contact. My mother-in-law was just telling me last week she went to a visit at a doctor's office, and she said the doctor didn't look at her once. Like, he was just facing the computer. I understand that electronic charting has really kind of wreaked havoc on our workflow, but we have got to take the time to connect with the person, or else everything else we say might get lost. So, we need to turn away from the computer and spend some time communicating with our patients and families and make them comfortable at the starting point. Again, using plain language is going to be really important. We can lose people in medical jargon. If you had a jargon jar in your office, I bet you it would fill up with cash and you would have pizza parties every week, because I think it's really just most folks are unaware of how much medical jargon we use in healthcare. We spend all this time becoming experts in the field and we want to share that with everyone, but really think about if it's benefiting the patient. So then, plain language and getting them to explain back in their own words or to demonstrate. We really need to take responsibility that this is on us, right? They're coming to us for health care, health advice, health planning. We need to take responsibility for the communication piece as well. We do not want to frame this as, I want to test you now. Okay, I've told you everything, I want to make sure you understand. So, repeat back what you heard. You don't want to make the person feel shamed. You don't want to test them. We want to use open-ended questions that invite them to say something. So this is, so hey, I want to make sure I did a good job explaining everything today. Can you just tell me what you heard? This does not have to be a complicated situation. Just get them to say something. Avoid the yes and no questions. If you go on a 10-minute explanation and then you say, okay, does that sound good? And they go, yep. Is that 50%? No. Are you sure that they really understand before they leave? No. They need to explain it back in order for you to really know that they understand what's happening. So, not to test them, but to ask open-ended questions that give them a chance to explain. And then if it doesn't work, we've got to take the time, a couple minutes to recalibrate and do it again to make sure that it's clear before they leave. Otherwise, they'll be back in your office. They'll be calling your phone lines. They'll be missing their treatment plan, complications, back in the hospital, whatever it is. That small effort to re-explain things can really go a long ways. And then, including the support person, this is really key because a lot of folks are super stressed out in healthcare environments, whether it's an office visit in a busy practice or in the hospital. People may not feel well. I mean, there's a reason they're coming to the doctor. They don't feel well. They're sick. They're maybe in pain. There's a bunch of reasons why they might not be able to take in information. Having a support person with them is really going to help ensure that that message gets through. So teach back, here's just a couple examples to give you in terms of like say screening for life, for cancer prevention. These are some simple ways to ask open-ended questions. I encourage you to find your own way. Find what works for you. Like I said, in your own words, how would you describe, what makes screening easy and affordable? Because a lot of people may not realize how easy it is to get screening. Just to be safe, we really want to make sure that we're safe in healthcare, right? Just to be safe, can you tell me why you want to catch cancer early? See if they really understand what your explanation was. Can you tell me how you would encourage a friend or family to get screened? Whatever the topic is, even if it's a general statement of what questions do you have? Encourage them to ask questions, right? Or when you get home, how are you going to explain this to your spouse? Everything we talked about today. Find what works for you and start weaving it into your dialogue. Now, if you're a real systems change person and you understand the importance of what I'm talking about today and you want to go to the next level, the only way to make sure that your clinicians are doing teach back well is to observe them. It's like any other competency, if you're doing a diagnostic test or a procedure, how do we make sure folks are doing that correctly? We observe them and give them feedback. So there is a tool available. You can reach out to us or you can take it right from this slide. This is a tool that we use to observe folks right here in our health system to give them that just-in-time training. Somebody might be really great at 8 of these things, but maybe they have a little opportunity in a couple of them, the way they phrase something. This is going to help that person really enhance their skill around teach back. So if you want to start doing some observations in your practice, you might learn a lot about how communication really takes place in your care setting. All right, just a couple of words here on plain language. No pun intended there. Plain language is really the key to all of this. If we're coming in with highly complicated medical jargon, we're going to miss most of the people. And remember, if you start with plain language, living room language, we oftentimes call it. If you start there and someone starts asking you really detailed questions, that's your chance to flex your medical muscles and go to work with everything that you can share. You're experts in the field. You can ramp up your explanations if it's being received well. But if we start in that high place, we're going to miss a lot of people. So we have some best practices we can share with you along these lines, but really think about how to say things without medical jargon. What kind of tools are you using that emphasize plain language instead of complicated medical jargon? How do you speak to people? The actual words you use coming out of your mouth. Those are very important aspects, and then making sure we're doing teach back at the end of all of that. I'll wrap up here by saying we have a lot to do to empower our community. One of the things that the Health Literacy Council wants to do is really share this message far and wide that it's okay for you to ask questions. It's your health. You have a right to leave this encounter understanding what is going on. And then getting people used to this idea of teaching back. We need to take it on as healthcare professionals, the responsibility to ask for teach back. But the other side of that is folks need to get a little bit more comfortable with just explaining back what their understanding is. So we have a marketing campaign that's statewide. Your practice can co-brand all of these materials. They're available for free on our website. You can download them and co-brand them and then put them up around your practice or use them on your social media, whatever you'd like. But let's get this message out far and wide in our state that folks have a right to understand their healthcare before they leave an encounter. One way that we're doing that, just to share an example of how this works, is we created a prescription pad uh, type of an asset that we're handing out in community organizations and venues. So don't be surprised if someone hands you one of these prescriptions for health in your next encounter. This is to prompt you if you forgot to do teach back. This is a way that we're trying to empower people to say, hey, your doctor's giving you all kinds of prescriptions. Here's one for you to give them. Before you leave the encounter, make sure that you're getting a chance to explain back what you understood from this visit. So you might see these kinds of things out there. In terms of the Health Literacy Council, again, didn't have a lot of time today, but we have a website. We have lots of folks engaged around the state. If you want to learn more or want to share this message, please let us know. You can email us right from the website. There's an email address there. You can become a member, sign up, and you'll get all of our newsletters and communications. If you need more training, let us know. If you want to volunteer some of your time, we'd love to have more voices at the table. And then the biggest thing you can do is spread the word because there's only so many folks on this call. We really need you to take this message back to wherever you came from before you were here this morning and spread the word within your practice area, within your clinical staff and your administrative staff. So that's the message for today. I think I have a couple minutes for questions. Thanks for the time.
Thank you so much for your presentation. We do have two questions here. How does health literacy intersect with value-based care metrics and payer quality reporting requirements?
Value-based care metrics. You can impact basically any health outcome that you're working on. There is a health literacy lens to whatever that is. So, health literacy is a social determinant of health. You may not see it on graphics that you see around social determinants because it's kind of unrecognized in many ways. We just don't see it as a problem. But it is a social determinant. So, if you address health literacy in your practice environment in a systematic way, you will impact the population health, the value-based health metrics that you're working on. You can have a direct impact on that. So I would say it's very important to value-based care. It really is one of the key ways that we can intervene with a population is to be better at communication. In terms of reimbursement, I think we have some work to do, which is why we have payer representation on our council. We need to find out exactly what the incentive structures need to be to promote clearer communication. So we're working on that from a policy and advocacy standpoint as well. I hope that answered the question.
Thank you. Another question is, are there simple workflow changes at check-in, discharge, or billing that have been shown to improve patient comprehension?
Yeah. So the assets that I said we created to put in the hands of patients, and the campaign, the marketing campaign that I said you're welcome to co-brand and spread around your practice. That's the first part is giving people permission when they're going into an encounter to have the expectation that they need to have clear understanding before they leave, right? If it's all about process and just sort of cranking people through our appointments, we might miss the mark. We really want to set the stage that it's really important. They are empowered going in to have what the questions that they need to get answered, and to have a chance to share their understanding before they leave. So I think if there's anything you can do in your practice to create that welcoming environment, and we have the materials you can put up, I think that's the first step. And then there are other steps that I could go into, like if you're using patient education materials, where are they coming from? Who's vetting them? Are they plain language? What grade reading level are they at? Are they available in multiple languages? There's a lot of sort of downstream things that you may be doing as a practice in terms of education and communication, and looking at those systems is another aspect.
Thank you. Thank you so much. That was all of our questions. I will be sharing these slides with everyone after today's presentation, and we all are also recording for YouTube as well. Thank you so much, Greg. It was a great presentation.
All right, thanks for the time, guys.
Thank you. Okay, so our next presenter is Michelle Seymour. Michelle has joined the Medical Society of Delaware in January 2014, where she has supported physician practices as a quality improvement coach and as the past manager of MSD subsidiary MedNet of Delaware. Michelle is now the Director of Membership and Community Outreach for MSD, where she works to recruit new members and engage current members of MSD. In her role as Community Outreach Director, Michelle oversees the Voluntary Initiative program and supports her team in connecting uninsured Delawareans to specialty care, chronic disease, education, medication assistance, and diabetes programs. Michelle also serves as the staff person for MSD's statewide mentorship program, as well as the Environmental and Public Health Subcommittee. Welcome, Michelle.
Good morning. Thank you so much. And thank you, Greg, for sharing that important information. I think we were excited to team up with this presentation in relation to health literacy because from an operational standpoint, it becomes really important during referral transitions. And that's a lot of the work that we do with the Voluntary Initiative program in relation to your practices. This is where confusion can create delays. And if we strengthen understanding at that moment, we can improve efficiency for everyone. So I just want to start off with a brief history. The Voluntary Initiative Program at the Medical Society of Delaware first offered a helping hand to Medicaid recipients in the late 1990s. This concept was envisioned by Dr. James Marvel during his first MSD presidency to address the Medicaid crisis in the early 1990s, at a time when many Delaware physicians were closing their practices to Medicaid patients because of low reimbursements, causing them to be dispersed unequally among fewer physicians statewide. Dr. Marvel envisioned that MSD could act as a gatekeeper to ensure that the doctors who agreed to see Medicaid patients were not overwhelmed with Medicaid's low reimbursements. In the late 90s, Medicaid moved to managed care, and the focus shifted to the growing struggle of the uninsured residents of Delaware. MSD took action to restructure the VIP program, launching a new version, which we now refer to as VIP2, on June 11th, 2001, this new program began. So we're pleased to say that this year we are celebrating the 25th anniversary of this important program. VIP2 was really built as a solution to get quality, affordable healthcare access to the overwhelming number of low-income, uninsured individuals residing in Delaware. So VIP soon became a nexus for assigning those who needed it a primary care physician or health home and arranging referrals for them to see the specialty physicians enrolled in the Community Healthcare Access Program, CHAP. If you were around a long time ago, what is now known as the Healthcare Connection used to be called CHAP. So it is the same program. However, it was redesigned under the new title when the state of Delaware took over this work. So CHAP was a program for those low-income, uninsured individuals in Delaware whose annual income was 200% or below that of the federal poverty level. The Healthcare Connection is administered by the Delaware Division of Public Health with funding support from the Delaware Health Fund. The Voluntary Initiative Program under the Medical Society of Delaware is administered by our Delaware Foundation for Medical Services Foundation. So MSD's Voluntary Initiative Program is really designed to support the Delawareans who the state enrolls into the Healthcare Connection. The Screening for Life program is managed by the same department in the state of Delaware. The application that an individual completes is processed to allow that person to be active in either or both programs. But it is important to note that they are very different programs with very different goals in mind. So in order to be eligible for the Healthcare Connection program, a patient must be uninsured, be at or below 200% of the federal poverty level, not qualify for any other public health insurance options, and are exempt or ineligible for the marketplace. The Division of Public Health Healthcare Connection program determines participation eligibility. If you're aware of a non-insured individual in your practice who may benefit from this program, and to check eligibility, you can call 211 or email DHSS_DPH_healthaccess@delaware.gov. So the Medical Society of Delaware is contracted with the Department of Public Health for this program, but they do all of the enrollment of those individuals into the program. We do not do that part. Each applicant applies for the program by completing an application that is then submitted to the Healthcare Connection. There is one application for HCC and Screening for Life, and as I just indicated, a patient may be enrolled into one or both, depending on their needs. Different factors, including age or insurance coverage, may in fact affect their enrollment. DPH's HCC coordinators will contact our VIP staff here at MSD to advise which patients are enrolled. And our Alessandra, who is our HCC VIP Health Services Coordinator, will work to assign each patient a primary care physician and handle any medical referrals needed for the patient. So while participating in VIP, physicians decide how many HCC patients they're willing to serve and how often they will serve those patients. You can change this amount at any time. When you first enroll as a voluntary initiative program practice or physician, we do ask you to fill out an enrollment form to get this information, but it's not set in stone. You're definitely able to update that information as the needs of your practice change. We also note that every physician in practice stipulates what they will charge for the office visits. Again, we do not in any way have any control over what you decide to charge the patients, but we are able to let the patient know what those fees are and what to expect when they come into your office. We do have processes in place to track the patients that are assigned so that we can honor the limits that have been placed by your physicians. So how can you help patients access assistance through VIP? If you have an HCC patient in your office who needs follow-up care with a specialist, please reach out with a referral request to our healthcare coordinators. Alessandra is available every day, Monday through Friday, and Christina Sanchez works Wednesday, Thursday, and half-day Fridays. Any patients discharged with a prescription or who may need additional supplies, such as durable medical equipment, should contact Pam Taylor. At the time of enrollment, every Healthcare Connection patient is provided with the HCC Patient Services flyer that has contact information for VIP staff. If you do not have a current referral form, please reach out and we can provide that to you, along with other brochures and other information that you can give to your uninsured patients. Health literacy really becomes most critical at transition points in care, especially during specialty referrals. There are some practical talking points to consider based on what you learned earlier today. First, confirm that the patient understands the reason for the referral, using plain language when explaining the next steps that they are to take. Verify their contact information is correct, and use the teach-back method to ensure that they understand their next steps, and provide written or printed instructions that they can take home with them. This ties literacy directly to operational efficiency. Before checkout, a simple confirmation like asking the patient, "Can you tell me what the next step is?" can dramatically reduce missed appointments. This connects literacy to fewer no-shows, fewer repeat phone calls, and reduced staff load. I mentioned earlier that there is a Healthcare Connection patient flyer provided for every patient, and we can also send those to your office. This is just a little screenshot to describe who patients should contact with depending on what their need is in relation to the program. You and your practice staff are the operational backbone for the VIP2 program. Understanding how you manage workflows, such as your referral process, your billing process, and scheduling processes, allows our VIP team to work with you efficiently and effectively. Patient access problems, compliance, and communication are key aspects to help us in scheduling you with your patients. As a practice who's part of the VIP network, this is what to expect when an HCC patient arrives for their appointment. Patients are screened to determine eligibility before we reach out to schedule them with your office. Each enrolled individual will have an enrollment card confirming that they're active in the HCC program. It's important to remember that this is not an insurance card. HCC is not insurance, but rather a program to allow them to receive those discounted services that can be provided. Once an individual is enrolled in HCC, our VIP staff will activate that person, ensuring he or she has a primary care health home and assisting them in choosing one when needed. Many HCC patients need follow-up medical specialty care, labs, radiology, or surgical procedures, and our VIP team uses our network to schedule the patient for the care they need. Again, this is not insurance, but rather a program that is intended to link enrollees to discounted medical services that they may need at a cost they can afford. This is why keeping our team updated with changes to your costs and scheduling procedures and referral processes can help us when speaking with the patients to let them know what to expect for their visit. This program is designed for the adult population, and on the ID card, there is a code that denotes everyone's level based on the current poverty level limits. Some practices decide to charge flat fees, and others use the federal poverty limit levels to determine what to charge a patient. One of the type of assistance that VIP provides is pharmacy assistance. VIP staff provides centralized pharmacy assistance for all HCC enrollees. Pam Taylor has been with VIP for over 15 years and has an established protocol for the collection of information and paperwork that is required by the various pharmaceutical programs. Patients may be eligible for low or no cost medication, and that is what Pam works to provide for them. Providing Pam with a patient's current medication list is vital to ensure that she provides patients with this information. Our health service coordinators, Alessandra and Christina, are the connection between the HCC patients and your offices for their physician care. Pam, as a pharmacy coordinator, focuses on patient compliance by providing specialized follow-up as needed, including medication assistance, connection to needed resources such as the diabetes program. Today, the Voluntary Initiative Program's Diabetes Assistant Program offers a free bilingual speaking glucose meter to all enrolled diabetics, along with supplies that are designed to greatly benefit patients who suffer from retinopathy and peripheral neuropathy. The Prescription Assistance Program has also established resources for durable medical equipment to provide patients with equipment such as CPAPs, BiPAPs, walkers, canes, wheelchairs, or other much needed cost reduction to the patient. Enrollment in VIP is easy. There is a simple online registration form to complete via SurveyMonkey that is used for physicians, allied health professionals, and other ancillary service providers to enroll. You can access this directly from the Medical Society of Delaware's website. The VIP team at MSD has made health literacy a focus to better communicate with the individuals they work with in the HCC program. I just want to thank so much to Greg and the team for educating us and supporting our efforts to ensure the individuals we work with can make better informed health-related decisions. Key messages is that health literacy matters when care changes hands. So clearly explaining the reason for a referral, confirming that understanding before the patient leaves, Providing simple written instructions, confirming contact information, and clarifying urgency level of the referral will have a greater impact, resulting in fewer no-shows, faster scheduling, reduced staff follow-up, and improved patient confidence. This is the contact information for our team, and a little bit more information can be obtained from the Medical Society of Delaware's website on the What We Do section. We also have a link for the state of Delaware's healthcare connection program enrollment that you can use if you have an individual who needs to be enrolled.
Thank you so much, Michelle, for the great presentation. Are there any questions for Michelle today? Okay, I don't see any questions coming in. So thank you so much for your great presentation. We have recorded this session and we will be posting it to our YouTube channel. We will be making slides available today for both presentations, and I will be sending those out via email. Also, we do have a podcast called Healthcare Reality by Dr. Biasato. He has also had a topic on his podcast in regards to health literacy, and it is also available on our YouTube channel. So we do encourage folks to visit our channel, check out our podcast. It's available on all platforms, Podbean, on wherever you stream your podcasts, you will be able to listen to Healthcare Reality. We're going to put that information in the chat box if anybody is interested in searching that. And again, thank you again for a great presentation. I really appreciate it.
I have one question. So the providers, they are reimbursed or they are paid for their services right on the spot from the patient based on whatever pay scale that they provide for the HCC patients?
Correct. So similar to the Screening for Life is funded through federal dollars. So those individuals, the reimbursement is provided through the program. The Healthcare Connection was provided as a way for individuals who don't have insurance and would be self-pay to see physicians and practices that are willing to do a reduced fee for that patient, understanding that they're not able to afford a cost that is higher due to the poverty level where they may exist.
Correct. Okay.
So we do let the patient know to reach out to your billing office. So if a payment plan is needed or, what payment the patient may expect to bring, that they know that before they come to your office. We do reiterate to all our patients that they should be prepared and that they know this is not a free visit or, things like that.
Okay, thank you.
You're welcome.
Okay, thank you. Thank you so much. Okay, if there are no other questions, we'll go ahead and we'll close out. Thank you again for your great presentation.